So this is our Patient Care Center project for OB. I'm Nurse Aiden Shields.
I'm Dakota Shears.
I'm Mackenzie Williams.
Jacob Williams.
And I'm Megan Atkins, and I'm the mom.
So our pamphlet, it's called Breastfeeding the Newborn with Severe Vision Defect in the Native American Culture. So the first thing that we're going to talk about is the honoring tradition and new life. Some ways to honor that is breastfeeding is a natural way to welcome and nourish new life. Care in the hospital may still include family, elders, and community members. Prenatal care can be seen as a mix of traditional culture knowledge and care by medical teams working together. Healthcare workers are required to respect cultural beliefs and honor any traditions. These can vary from dieting, activities, and medications given. These practices are meant to protect the baby from their cultural standpoint. Monitoring vitals is crucial in pregnancy. It can be an early detection of incoming complications that can endanger mom/baby. Things to monitor would be blood pressure, weight, growth, urine culture, symptom management, and then a balanced diet of protein, iron, calcium, folic acid, and vitamins severely decrease risk of birth defects.
So my part is getting started with breastfeeding. So to begin breastfeeding, or you want to begin breastfeeding within the first hour after birth if possible. You're going to want to feed your baby every 2 to 3 hours throughout the day and night. Watch for early signs of hunger, which are going to include turning the head towards the breast, sucking on the hands, restlessness, and soft crying. You're always going to want to sit in a safe and comfortable position. Use pillows to support your arms and baby, and bring baby to the breast, not the breast to the baby.
Okay, and I have breastfeeding positions for mom and the signs that the baby is getting enough. So the goal for this is to keep mom and baby supported, relaxed, and relax using different holds to help the baby latch onto the breast correctly and feed comfortably. So the first hold is called the cradle hold. We're going to put your baby's head in the bend of your arm, and your baby's tummy is going to face yours, and then you're going to support the baby's bottom with your hand.
Okay. Am I doing it correctly?
So just gonna, there you go, make sure you hold, yep, just like that.
Perfect.
And then the second is the football hold. The baby is going to rest along your side, and you're going to support the baby's neck and shoulders, and then it's going to, you're going to have a good latching position when learning. So for this one, I'm going to pick up your baby real quick.
Okay.
Okay, and then we're just going to come to this side, and we're going to right here. Yeah, like that.
Okay.
And then the second one, or the last one, is the side lying position. So for this one, you would be lying on one of your sides, and then you would be facing the baby, and then the baby's going to rest on its side close to you. And this is a safe position for restful position for night feeds, and you're going to keep a pillow behind your back.
Okay.
Do you have any questions?
No, not currently.
Okay, and then the signs that your baby is getting enough, we're going to allow you to feel, you're going to feel swallowing movements and the positioning during feeding, so what we just did. You're going to, they typically ate 12 to 24 times in a 24-hour period. 12 to 8 times, 8 to 12 times in a 24-hour period. You're going to want 6 or more wet diapers per day after the first week, and 3 to 4 bowel movements daily in early weeks, indicating adequate feeding. I would teach rhythmic sucking and swallowing sounds, and then and your breasts are going to feel softer after feeding, and then if the baby is snacking or licking its lips, that's early signs of hunger, along with opening and closing the mouth, and then rooting. And and then bringing hands to the mouth and sucking on fingers or fists. And this is also the best time to feed. And then active squirming or moving arms and legs, more head moving side to side looking for the breast, increased sucking motion, and fussiness is active hunger signs. And then late hunger signs is just crying.
Okay, we're gonna talk about the benefits for mom and baby of breastfeeding. Breastfeeding helps your baby grow strong, protect baby from illness, helps bonding between mother and baby, and provides the perfect nutrition for your baby. Benefits for the newborn. Breast milk contains substances that assist the critical growth and development of vital organs and systems, including the brain, immune system, eyes, and gastric tract. Breastfeeding provides a possible protective effect against certain conditions or diseases such as SIDS, insulin-dependent diabetes, and allergic diseases. Research shows that the babies who were breastfed have lower risk of childhood obesity, type 1 and 2 diabetes, asthma, and allergies. Benefits for the mom. Breastfeeding releases the hormone oxytocin, which helps the uterus contract after birth, reduces postpartum bleeding, and helps the uterus return to normal size faster. Breastfeeding burns approximately 400 to 500 extra calories per day, which may help mothers gradually lose pregnancy weight. Women who have breastfed have a lower risk of breast, ovarian, and endometrial cancer. Breastfeeding may lower a mother's risk for type 2 diabetes, heart disease, and high blood pressure.
Okay, so do you have any questions for us?
I don't think so. If you just wanna watch me practice the positions.
Yeah.
So the first one is like this,
Mm-hmm.
okay? And then the next one, you said football,
Yep.
like this,
Yeah.
okay? And then you said I could be lying on my side
Yeah.
for the other one?
Yeah.
Okay. No, I don't think so.
Alright, that's our patient-centered care project for OB.